Welcome to the Lindquist Dental Clinic for Children's Safety and Evacuation Checklist video. Through this orientation, you will familiarize yourself with many of the safety and evacuation items and their locations at the Parkland Clinic. We have two nitrous oxide and oxygen shutoff panels. The first one is located in operatory number 2 and can be accessed by pulling on the center ring to reveal the shutoff valve behind. Directly besides this panel are the power buttons for the compressor, vacuum, and air. Remember to turn these off at the end of the day or in the event of an evacuation. Mounted in Op 6 is the first of 4 fire extinguishers we have on the first floor. Always take note of pressure levels and inform safety admin as soon as possible if levels are either above or below normal. In the event of an evacuation, our MSDS binder, located in the top cupboard of the sterilization area, must be retrieved and taken off-site. Our infectious waste log binder is also located in the cupboard above sterilization next to the MSDS binder and must be made available upon request at any Department of Health inspection. Please familiarize yourself with the location of the emergency spill kit located at the bottom cupboard in the sterilization area. The end cap wall just in front of the sterilization area houses many safety items. Among them is our safety binder, the go-to manual which lists all of our important safety procedures, contact information, and forms for recording safety incidents and accident reports. Retrieve this item in the event of an evacuation. In addition to a wall-mounted first aid kit, there is also a portable one available. Still on this same end cap wall is a second fire extinguisher. Portable pulsometers and blood pressure monitors are stored on the shelf just outside of Steri near the back office desks. Inside the doctor's office, you will find our AED defibrillator unit in the corner on the desk. Periodic checks for battery life should be made monthly. Our portable dental procedure kit is kept under the doctor's office desk area and should be taken off-site to use on any patients needing continued care in the event of an evacuation. Lindquist's Parkland location has 6 main exits, including our southwest rear exit located next to operatory number 10. This exit leads to the west side of the building where there is a storage shed on a pathway that wraps around the south side of the building. This pathway leads to the southeast gate, which can be unlatched and used as an escape route. Three main doors at the front patio of the building lead back inside to the patient waiting and employee entrance areas. These can be used as emergency exits as well. Our second set of nitrous oxide and oxygen panels is located next to operatory number 12. The gas can be shut off at the panel. or the panel next to it can be pulled out to access the emergency shutoff handle. Also next to operatory number 12 is another fire extinguisher. As you make your way towards operatory number 14, you will find our northwest rear entrance, which leads to the back of the building. Turn right towards the northwest gate, which can be unlatched and used for escape in the event of an evacuation. There is also a side exit which opens from the outreach office. Be careful when walking behind the building, as the terrain may be uneven or full of natural or unnatural debris. In the back main office areas, the outreach office can be found at the northwest corner of the building, which leads to the northwest side exit, which opens up to 131st Street. This door can be used as an emergency exit as well. Next, you will find the final fire extinguisher along with the employee emergency roster checklist by the accounting office. This list should also be taken off-site in the event of an evacuation and used to make sure all employees are accounted for. There is a door in the patient waiting area that leads to the north stairwell. At the top of the stairs is the north stairwell bathroom, as well as the philanthropy office. In the event of an emergency, please remember to actively check for any upstairs occupants who may not be aware that emergency or evacuation procedures are taking place. One of 3 fire extinguishers upstairs is located in this stairwell as well. The upstairs conference room joins the north stairwell with the middle stairwell and the CEO's office. Located by the conference room sink is the second fire extinguisher upstairs. If unlocked, in the case of an emergency, the south stairwell and break room can be accessed by going through the CEO's office. In the south stairwell, you will find the final extinguisher upstairs, just outside the employee break room. The employee entrance is also our final exit, which can be used by both employees and patients in the event of an emergency. During an evacuation, all building occupants will meet in the southeast gravel parking lot next to the tree by our dumpster area. We hope you enjoyed this training video. Thank you and stay safe.